And at this time, I would like to turn today's program over to Canada Health Infoway. The floor is yours.
Thank you, Monique, and welcome everyone to Preparing the Next Generation of Pharmacists for the Digital Age, third in a series of clinical adoption webinars from Canada Health Infoway. My name is Cindy Hollister. I'm Director of Professional Practice with Infoway's Clinical Adoption Team and will be the moderator for today's webinar. I'll start with getting a few housekeeping items out of the way, beginning with this notice that the webinar will be recorded and may be posted on Infoway's website. And all participant lines are muted throughout, though as has been mentioned already, you've already been told about the question and answer feature if you do want to ask a question. And on the next slide, we'll just actually show you what this looks like so that you can send your questions to all panelists, and we really do encourage you to submit the questions throughout both speakers' presentations, and they'll be addressed all together after our feature presentation. Next slide is just simply a disclaimer, and I'll just give you a few moments to read that on your own. So over the course of the next hour, we'll be following this outline, starting with an introduction covering objectives of the webinar and some background information about Canada Health Infoway and our clinical engagement strategy. Then we'll go on to our feature presentation and finish up with a question and answer session. So the objectives of this webinar are to describe Canada Health Infoway's clinical engagement strategy, to discuss the development of the Informatics for Pharmacy Students e-resource, and to showcase the e-resource, and then to explore some potential other uses of the e-resource. Joining me today are Maureen Charlebois, Infoway's Chief Nursing Executive and Group Director for Clinical Adoption, and Marie Rocchi from the Faculty of Pharmacy, University of Toronto, and representing the Association of Faculties of Pharmacy of Canada, AFPC, as the faculty lead. And I'm now going to turn this over to Maureen so that she can provide her introductory presentation to be followed by Marie for our feature presentation.
Great, Cindy. Thank you very much. That's certainly always a big mouthful, the names of our different organizations and associations. So pleasure to be here, and thank you for your interest and your time. I'm just going to spend the next few minutes just really providing the context of how the AFPC e-resource came to life. At Canada Health Infoway, for those of you that are not aware, we are federally funded through Health Canada, and we work in collaboration with our 14 federal, provincial, and territorial partners. Last year, we released a new vision based on consultations with stakeholders from across Canada, and it simply states, healthier Canadians through innovative digital health solutions. As part of our strategic investment role, we provide funding across Canada to invest in the infrastructure such as the diagnostic imaging, drug information services, laboratory repositories. And this is essentially to build the foundation of which the electronic health record will be fully accessible and realized. To date, we have invested approximately $2.1 billion, and it is estimated that the full cost of implementation of electronic health record is roughly $10 billion. So we do have a ways to go, and that is why one of our priorities is really to leverage the existing investments and to take advantage of the trends and emerging insights so that we can improve both the patient experience and to provide clinicians with the tools that they need to provide better patient care. Clinical adoption, the portfolio that I work in and I have the pleasure in working with my team, we provide thought leadership across Canada in 4 key areas. Our benefits evaluation, to date we have released 4 pan-Canadian benefits evaluation studies. We also provide thought leadership and support in our change management, and we have, it was back in 2011 through our change management network and specialists, released a change management framework so that we can, that you can leverage this and not reinvent the wheel. We've also, one of our key priorities is knowledge exchange translation, and hence the webinar series is trying to do that. In addition, we have many publications and outputs from our hundreds of projects that are happening across Canada. And then we have our clinical engagement framework. And that consists of 5 key areas. And this strategy was implemented back in 2010, and it really was essentially to bring together clinicians both in direct clinical practice, in leadership positions, and as well those from the next generation, the education. And so we've been working with a number of associations, national association, provincial associations, to work together to advance effective, professional practice through the use of technology at the bedside. So we link with clinical leaders, and we've established clinical reference group, change management reference group, a clinical council. We also provide direct funding so that clinicians can work with other clinicians to mentor and educate their peers in using technology effectively and in practice, and as well the next generation. And that's where the Association of Faculty of Pharmacists come in, is that this strategy focus was to ensure that clinicians in training are ready to practice in and gain value from ICT-enabled environment when they graduate. So really preparing for that digital age. And also to integrate the concepts and expectations related to the use of technology in practice into the curriculum design processes. And why this was so important, because when we started out, the whole notion of informatics and that was it was seen separate to the professional practice education. And so these 3 projects were funded. When I say 3, it was the other 2 are with the Faculty of Medicine in Canada and with the Canadian Schools of Nursing across Canada. Each one has a varied objective, but they're all aligned to this focus. And we have had great outcomes, and the nursing informatics, the nursing projects have developed the entry to practice competencies for registered nurses. AFPC actually have been very influential in using a lot of the outputs from their project to influence then the competencies for the CanMeds and other curriculum development. And pharmacy. Our pharmacists have also, in addition to the e-resource, which I'm going to be turning it over shortly in a second to Marie, they've also developed the entry to practice competency for pharmacists. In addition, we really wanted to identify and showcase leaderships out there. So leaders both within faculty and in the students. And so who you see there are some of our recipients of both faculty and students from across Canada to say, hey, they really are paving the way to a new way of practicing and educating in a digital way. So with this, I would now like to turn it over to Marie, and she will now provide an overview of the project and the e-resource.
Thanks very much, Maureen, and let me echo the words of welcome and to thank Canada Health Infoway for the opportunity to present this work today. I did remark to Cindy that I felt as if the project had finally made it to the big time, or whatever the Canadian equivalent of Broadway is. You'll notice that I didn't say TIFF. So with that, our feature presentation is coming to you from the Canada room, very fittingly, of Canada Health Infoway offices. And so welcome to our matinee and our premiere. I'm representing the Association of Faculties of Pharmacy of Canada, and I am a faculty member, excuse me, here in Toronto, where I teach informatics and medication therapy management. I'd like to acknowledge the funding from Canada Health Infoway and really the leadership and partnership, and that of Harold Lopatka, who is the Executive Director of AFPC. What I'd like to do in the next half hour or so is provide you with some background on the project, and then showcase the product, which is the e-resource, share some lessons learned, and then discuss future use. So by way of background and backdrop, if you will, I won't spend too much time on our digital age, but that of information and communication technologies. I would suggest that our students have already arrived there. But I would like to share with you some thoughts about the changing nature of pharmacy practice. Before we do that, again, in keeping with our movie theme here, we won't watch these, but they are there for your access after this webinar. If you haven't already seen the Kaiser Permanente, a video clip of a technology-enabled environment, it's very compelling, and of course, more locally on the horizon is the fully digital Humber River Hospital. If we get focused on pharmacy a little bit, I was looking for images of sort of labware, and I got distracted by the image of funnels because I was presenting in Saskatoon not too long ago, and that was a funnel cloud just outside there. And then, of course, Saskatoon berry pie, and that was the best I could do, was a funnel cake. But the scope of practice for pharmacists is changing inexorably across Canada. So from a role of dispensing, or what we used to refer to as counting, pouring, licking, and sticking, and providing education about medications, depending on the jurisdiction, there are a number of evolving scope activities here. And no matter what the evolving scope is, the imperative to sort of communicate and exchange information is critical. And this, of course, is enabled by the highlight at the bottom, and that is informatics. So if you haven't seen the movie Inception, I would highly recommend it. We were thinking of polling the audience, but we don't have that capacity today. But I drew from a favorite database of mine, which is IMDb, to get the plot synopsis here. And in the movie, Leonardo DiCaprio is tasked with implanting an idea in a target subconscious. So if you will, bear with me, there are some messages that we wanted to impart to our next generation of clinicians. And one idea, particularly for pharmacy during this time of change, is that information exchange is critical. I work in the community and hospital pharmacy sectors, but 85% of pharmacists do work in community pharmacy, and I would suggest that the first generation of information exchange that we see on the left, which is paper and facsimile to clinicians, is still very, very common, notwithstanding the computer-mediated vision on the left. I'm sorry, on the right. So we really have a blend of them. Last year, the Canadian Pharmacists Association and Canadian Medical Association issued a joint statement that was very ambitious, for which I applaud them, that e-prescribing would be the norm in 2015. And given the sort of practical state of communications, I would suggest that there's some ground to cover. But importantly, both the expanded scope and this vision speaks to the landscape that our graduates will be encountering. And of course, this is the view from Ontario, and as well known to the audience, the state of integration varies across provinces. So we covet what is the state of the art in BC and Alberta, with apologies to Health Ontario. So the overview of the project at the outset, and Maureen and Cindy and Valerie, who are with me here, have been involved since the outset, was to develop an online education program for pharmacy students. And our target of fall of 2013 was loosely reached. We launched by the end of 2013. The main project deliverables are highlighted here, and Maureen has already spoken about the competency framework, which is available on the portal. And then really the centerpiece was an online educational program and teaching guide, as well as we've heard about some student awards. So this is a screen grab of the landing page, and we'll be coming back to a tour of that very shortly. This is how we envisaged the use of the e-resource by one of our subsets of end users, and that is the students. And that is, if you'll go from the left to the right with me, that the Informatics e-resource, when combined with other education and training for our students and access to technology and information, patient and drug information, that is, would lead to competence in pharmacy informatics and their ability to fulfill our overall educational outcome at AFPC of medication therapy expert. This synopsis, and you are the critic down there on the right, is from our landing page, and we decided to call it an e-resource for continuity with e-health, and it's a descriptive title, Informatics for Pharmacy Students. And the other set of end users are faculty members, and we would like them to use it within their respective courses, and ideally by all faculties of pharmacy within their program. And it is modular, and that was one of the goals. It may be completed by the students in sections or its entirety. We worked with a small cadre of Canadian pharmacy faculty members and clinicians, and our student award winners were third and fourth year students who were critically engaged in its development. And at the end of the day, our hope is that this is a very broad, almost a survey-type course, foundational treatment of this subject matter area, which Maureen has alluded to, that in some ways it's been a bit peripheral to mainstream education. I like to think of it as the orphan subject matter. But it is meant to be introductory, so for early year students with innovative learning activities. As the project took shape, we landed on 5 domains, which we'll share in just a moment, but we were also able to link them to the CanMeds roles, and the CanMeds roles are also part of our educational outcomes. The creativity of our students knew no bounds, and our logo was designed by Danny Wong, one of our students at the University of British Columbia. Maureen's mentioned the entry to practice competency document, and we did draw largely on the CASM work in nursing, but we also did look at a number of other competency frameworks from the United States, from COACH, from AMIA, et cetera, and customized it for this profession. And in terms of the state of pharmacy informatics education, at the time of the proposal, only 2 schools out of 10 had formal courses in informatics, again, speaking to the peripheral status of this subject matter. Although all did teach drug information and critical appraisal and documentation, we didn't want to reproduce this, but you can see that while we weren't running on empty, we had to do some work. And so we imagined that the resource would support teaching and learning, and so rather than be faced with the Sisyphean task of creating materials, we hoped that it would develop into a community of practice, and I would say we're on our way to accomplishing that. And in terms of the overall subject matter, it is obviously a very focused area, but one that we believe is very formative and important in any curriculum. So moving from the competency framework to the content development, we developed a matrix, and there's my shameless screen grab of Keanu and company. And the matrix was our blueprint, really, to development. And the details are not important here. I know it's very, very busy, but I'm very happy to share with anyone who would like to see it. And it was really a number of topics or domains, topics nested within domains, and a number of themes and common design elements. So to speak to the themes, I've selected 3 from about 8 or 9, and we wanted to have themes that would resonate and provide continuity throughout the resource. So in this context, we focused on the medication use cycle, and I would suggest that this is also very relevant for medicine and nursing. We wanted to draw out this notion of interprofessional collaboration, more than a notion actually, it's a way of being, I hope, and patient-centered care and patient safety. Those are our big themes. And some common design elements where this it created a bit of a challenge, the differences between provinces, but it also allowed for comparative analysis. And an innovation for us was the use of virtual patients. They've been used a lot in medicine, and I'd like to acknowledge a lot of the work that's been done there in the AFPC project and my colleague Marcus Law at the University of Toronto. But our literature review also spoke to the need for authenticity in this subject matter, in particular in informatics, and that it be linked to clinical practice examples. And then this last idea of key points and domain summary is depicted by the image on the right. I think our students can be prone to a bit of reductionism, and they did describe some of their coursework as an information assault. So that's an image of, what we wanted to avoid in the resource, but also make it comprehensive. And so on to the sneak preview, and I'm going to keep you in suspense for just a little bit longer and take you through some screen grabs. We have found that when we demonstrate this, sometimes for the remote viewer, such as yourselves, the granularity doesn't always come through. So I'll take you through some screen grabs. The Academy in this case is not giving any awards. They are the faculty. And we look forward to your feedback. I always say that all feedback is friendly. And we certainly are very willing to provide access to anyone who might be interested. So as I mentioned, this is the landing page. And when we go to it, we will see the 5 domains. We had 6 in the matrix. The 6th is on leadership and management and optimization, and it is still in development. But we have Domain 1, concepts and context. Domain 2, information management and technology. 3 is knowledge management and technology. 4, privacy, security, and confidentiality. And 5 is consumer health informatics. All of the domains are color-coded. And in Domain 3, or in all of the domains, in fact, once you open it up, you will see the list of topics, and they are numbered. Once you open up a topic, you will see an array of icons and activities, and that's sort of in the middle of the screen. I'd like to point out that the navigation bar is, or the navigation menu, I should say, is on the left, and that was a really interesting effect that we had in implementation, and I'll speak about that a little bit less, but that was a deliberate attempt on our part in the design. The content itself is displayed in tabs. We also debated whether to have a book format or a tab format, but in keeping with sort of the Web 2.0 nature of our work, we opted against a book, and also because of the, we wanted to avoid the clicking, and what actually happens for the end users is you can mouse across here and click on the various tabs. We eventually follow these in alpha sequence to help the learner visually. And again, they can look at things at a glance. I'd also like to note that we used images where appropriate, and the text is surrounded by ample white space, and this is critical in online development. We adopted a number of active learning strategies. So here is a virtual patient helping the students work through using the drug product database as a source for monographs and an authentic clinical case. We used flashcards for the students to click on to reveal the answers, hopefully after they engaged in seeking the answers, and some elements of gamification. So this is a drag and drop activity. And again, we were very careful not to use too much of it because, of course, the device can distract from the important content. But it really did resonate well with the students. We were able to embed OSCAR, the open source EMR, for our pharmacy students to have a view of record keeping in medicine, as well as an enabled glossary, so that terms, when they were moused over, would pop up sort of in a form of just-in-time learning. And thank goodness for YouTube and actually Canada Health Infoway videos, because we were able to embed them in the LMS. And this is actually a video from James McCormick at UBC on evidence-based medicine, and it's actually set to a Coldplay song. It's very creative. It makes me want to understand the literature. And then the virtual patients, we developed, I think in total about 10 of them, and again, this is scenario-based e-learning, 4th generation. We have a number of quizzes, some that stand alone and some that are embedded in the virtual patients themselves, and all of this is tracked in the analytics within the LMS. And polls that allow for interactivity by the trainees. So I'm just going to switch now to the demo. And I'm using Google Chrome. It seems to support the virtual patients most effectively. And so on the landing page here, we'll go into the student e-resources. There we go. And these are the 5 domains, and as I mentioned, the 6th is in development, so it's hidden. I've got you in the administrative view at the moment. We go into Domain 4, which is privacy, security, and confidentiality. You will see the topics, and this topic I thought we could take a look at, types of breaches. Always a very interesting place for the students, and I think clinicians to go as well. And as you see, you mouse your way across to work through the content. Actually want to take me back here to the virtual patient. I thought we would look at the good old hockey game, keeping with our theme today. So icon pops up. Tom is a pharmacist working in peds in a hospital. Bobby Starr, I think that would be Bobby Orr, is coming to the hospital to visit. Tom would like to take a picture. They do. The patient is in the background. And Tom uploads it to his Facebook account. So the student is tasked with writing down the violations, and then once they've done that, there's a little bit of a case debrief and feedback loop. I thought we would go and take a look at a poll in Domain 2, which is Information Management and Technology. And this first poll asks the students about their monthly data usage. And this is to get an idea of how much data and information is generated. Now, I apologize, this is not displaying properly because I'm in the administrative view. And we have some polls that are definitely very well utilized. Consumer health informatics. Here are the topics arrayed here. We also have a number of discussion forums after the students undertake an activity. This is a virtual patient. I know it's a bit cartoon-like, but it's to get at the idea of information literacy and critical appraisal of websites. So some of the virtual patients are meant to depict rather simple concepts, and that was one example. Others are quite a bit more robust, such as this one on using the ECPS. More realistic, perhaps, and less cartoon-like than the ones that we looked at. And in this one, Eva is bringing in a prescription to the pharmacy, and the students' learning objectives are to use the monograph and make some decisions. So after they work through sort of the mental models of taking a history and so on, and medical history, they are tasked with decision-making. And so in this pathway, they're assessing the appropriateness of the medication. I'm actually going to choose the correct answer here. And then when it comes to the decision-making, in this case we're asking about safety information, the just-in-time information pops up, but there's conflicting information. And so, again, this models, this is a little tip for the students, to guide them in the decision-making process. Domain 3 is the largest of the domains. You can see here this topic 3.2 is all about electronic resources and decision support tools. Domain, maybe it is, and it's the end user here. And the section on documentation is quite robust as well. And in this example, the task is for the student to work through a case and document in the patient chart over here. And we take them through a number of different formats. And all of this is captured in the back end of the analytics. take you to Domain 1, which we haven't visited yet, and this is sort of the introductory, overarching domain, a lot of attention paid to e-health and telemedicine, et cetera. So it's a great starting point. So, watching this line here, and I think we're right on time. Okay. So we launched the e-resource in late December as a soft launch, and then we went live in January. And in the fall and early winter, a couple of colleagues of mine who were instrumental in the project, so Harold Lopatka, who was actually the lead, and Lisa Bishop, who was one of our subject matter experts and a faculty member at Memorial, we used the e-resource in 3 of our courses. The title, Informatics 3 Ways, was inspired by the Parisian restaurants that serve pork 3 ways, and we presented our findings at our national conference recently. So all of our end-user case studies involved 4th-year students, and they were 3 different educational settings / courses and provinces: a skills lab in Newfoundland, management seminar in Alberta, and a lecture on teaching and instructional design in Toronto. I'll share some key findings with you. At Memorial, the students completed documentation topic 3.2, and half of them participated in the study. And they were asked to do a self-assessment of their knowledge and skill gain. It was a little surprising, actually, to Lisa Bishop that they assessed themselves so sort of marginally at the beginning, given that they were in 4th year, and we know that students tend to self-assess a little bit higher. But it was very edifying to see that by the completion of it and combined with their lab work, they were feeling knowledgeable and competent. Again, keeping in mind that these were 4th-year students, they seemed to find a lot of value in it. The more encouraging findings, were that the students found their resource engaging and convenient, easy to navigate, they were satisfied and would like to see more of it used. At the University of Alberta, Harold teaches an elective in management, and he used the e-resource in a very innovative manner. He developed a number of case studies for them to consider from a management perspective after they had reviewed the e-resource. And I served as one of the facilitators. So in addition to using the e-resource, we also did an e-classroom, so it was a bit of a double threat. And it was very interesting to see where the students accessed both from. So on the left, you will see where they accessed the e-resource from, and on the right, the e-classroom. Not surprisingly, many of them accessed it from home, but a surprising number accessed it from the faculty building. This was one from the library, and other access points. So in the context of this case study, I can tell you that the virtual classroom and the e-resource were very well received. I believe the students described it as a game changer. It was shouldn't have been a surprise, but it was when it was live that the students preferred to type and not to speak. We were expecting them to ask questions, but they didn't. And they were very tolerant of minor technical difficulties. They definitely went the distance. And we're actually quite energized by it. I think there was quite a bit of dopamine going on, even though it was remote. But as a facilitator, I can tell you that it was challenging, to read the responses, but it was very interesting from a faculty development perspective, and the students were very appreciative of the engagement. In Toronto, I gave a lecture in instructional design to some students, and in keeping sort of with the theme of education and learning, I'll share some of the findings. And I asked them in one word to describe their impression of the e-resource, and you will see them all here. And as a psychometrician I work with would say, I think they're all moving in the right direction. And I did not edit them. And again, I've highlighted some key points that they wrote about in terms of its suitability for use and design principles. They thought it was well organized. They liked the variety. They thought it was authentic. We've talked about that. Although they thought it was suitable for early year students, all of them said, or the vast majority said that they did learn something from engaging with the e-resource. And not surprisingly, this idea of learner autonomy and control was really well received, although they do like the scaffolding and sequencing. A very interesting finding in all of the case studies was that the user guides were not accessed, and these are all on the landing page, and I guess because they're digital natives and it was very heuristic, they did not do so, which again speaks to how easy it is to access, but it also resulted, we had some comments about the navigation. People didn't realize the nav bar was on the left. They were expecting to see a next button, they were expecting to see the breadcrumbs, etc. So we're really sort of giving some thought to the navigation issues. We had a formal project evaluation done by the University of Alberta, and these themes resonated with some of what I've already presented. It was seen as a valuable tool for early year students. However, there seemed to be a lack of awareness on the part of faculty and departments, and again, speaking to what Maureen said earlier, maybe about the subject matter, maybe about the nature of the e-resource itself and its status. The evaluators suggested that having an advocate within each school might help with local adoption, not unlike all of the adoption issues which you are all very familiar with. And there was a desire by the educators that it be easily integrated into classes and coursework, as well as this idea that it might be used by other professions and be a really great opportunity for interprofessional collaboration. In conclusion, with the lessons learned and the presentation on the showcase, we believe that this development model has resulted in a very viable method for others, certainly for ourselves, and a scalable approach developing an accessible and valid e-resource. We used open source educational technology. We used Moodle in a very collaborative approach to design. And we think that the resulting platform is suitable for higher education and potentially workplace learning. Moving towards our discussion about future use, I'd like to offer a few thought starters for the group. EDUCAUSE, which is a consortium in the United States, publishes a Horizons report every year on trends in higher education. Let's synthesize the findings from 2012 and 2013 here and highlighted trends that I think are very relevant for the work that we are doing here, and that is the move or the availability of some massively open online courses that started at MIT and Stanford, and we even have some at the University of Toronto, of all places, which is this idea that information and knowledge should flow more freely. Tablet computing, of course. Our e-resource was not designed for mobile use, but a number of students did access it from tablets with very little difficulty, which was encouraging. This idea of games and gamification has been around since about 2006. Started with sort of serious games in higher education, but it's getting a lot of traction, I would say, in higher education as not being seen as trifling so much, but as a way to engage learners. And the idea of analytics, and it's really interesting to see in the back end of this e-resource where the students go, where they like to spend time, and what they engage with. And I included gesture-based computing and wearable technology because I think they're actually very suitable for the practice setting, which is certainly what we saw in the earlier videos in Kaiser Permanente. Canada Health Infoway has generously funded another project for us, and that's the development of a pharmacy education peer leader network, which will be kicking off at the end of the month, at the end of August in Montreal. And the notion here is to build on the success of the e-resource and facilitate its integration into the various curricula. And this is coupled with the consumer health strategy of Canada Health Infoway. So it will really kind of amplify that dimension of e-health. And so 10 pharmacy educators will be conducting local integration projects, and we'll be able to report back on that next year at this time. Another kind of provocative trend right now in workplace and higher education training is the notion of digital badges. And this really exploded in late 2011, 2012 as a way to depict credentialing and microcredits, which I've got at the bottom here. This idea that perhaps if you attend some workplace training, whether it's WMIS or a seminar, one might be offered a badge. It's quite controversial in higher education, as you might imagine, but it is considered to be more progressive, and again, it's getting a lot of traction, as are MOOCs. And it's simply a method to depict workplace education or lifelong learning And I like to think of badges as the new certificates. I'm not from the digital age, so I'm quite accustomed to hard copy certificates, which are depicted here. So on the left, we have a hard copy certificate. Both of these can be enabled in the LMS. And on the right, perhaps, our rendering of a digital badge. And there's a whole lot of things to consider in terms of what would be the requirements to achieve a badge, how is that depicted on your resume, et cetera. But I can tell you that the students get it. They get it right away, and they like to collect them. So when I look at the two end users in this group, the faculty and the students, I think we need to be thinking in parallel about both groups. And so now we'll be gauging the interest by the audience, and again, in keeping with our theme, if we were face-to-face, we could either ask you to hold up some paper or do some polling, but it's time to hear from you. So you are most cordially invited to a discussion for future use and questions. My contact information is here, as is Harold and Donna's, and Donna is our project manager for both Phase 1 and Phase 2. Thank you for your attention, and I'll turn it over to Maureen. Or Cindy, I'm sorry.
Okay.
Okay.
So thank you very much, both Maureen and Marie. And this is just really the reminder slide for you to use the question and answer panel to ask your questions. And at the moment, we've got one that's come in that is, this e-resource might even help clinicians who have been practicing for many years to become better informed about informatics. Are you aware of any practicing clinicians representing any professional discipline expressing any interest in using this e-resource?
Oh, great question. Well, so I've been on the out stumping this a bit at conferences and so on, and there's certainly a lot of interest from clinicians. We've had a couple of clinicians review it from an expert review perspective and for validity. They found it very engaging. I think we need to think very carefully about the level, because we, of course, don't want to offend any adult learners about the level. Having said that, I think that because most clinicians, I would venture to say, are not digital natives, this might be at the right level for them. The bottom line is that I think that with some modification, it could meet purposes for various audiences. We've looked at the idea of an interprofessional type of platform, which I think would foster some really interesting discussion, whether it's medicine, nursing, pharmacy, and other allies. That has a great deal of appeal. I will say that I did some workplace training in the fall when I was on sabbatical for a major community pharmacy chain, and there was a tremendous amount of interest from practicing pharmacists about what this might look like. So I think that's a great attention to get.
And I'll just add to Marie's response there. We actually have showcased it with our other clinician groups across Canada, primarily our physician and our nurses, and absolutely, they saw it as a real viable resource that they could use. Certainly some of the cases, obviously, are very specific to the pharmacist, but I think to your point about, you know, if this evolves and we can add additional more, let's say, interprofessional cases, I don't think you'd have to do much change at all. And, you know, there is such a need out there to focus on our existing practicing clinicians, those that are still in the paper age to move to the digital age. So I think it has a lot of opportunity, and I know Harold is very open to making it available for others to use as well.
Thanks. We've had a few other questions come in, but first I'd like to make a comment to just demonstrate the international audience that we have on the line. It's congratulations for the work. Here in Brazil, we are far from it. The question around, has this been shared with pharmacy technician programs?
Absolutely. When I was in Saskatoon, I presented to, I think it was close to 40 pharmacy technician educators who were represented at their national conference. And there was, I would say, pretty immediate buy-in. So we've actually set up, they all have access, those who asked have access to it, and they're looking at sort of using it this fall, I believe. we need to make some decisions about the resource itself and whether we'll keep it all in one site or whether it should be specific for certain programs, because from an instructor perspective, they'll want those analytics teased out probably.
And I think with our faculty peer network that is being launched at the end of August, we'll certainly be able to get a better understanding of what really will work in the classroom with our faculty peer leaders and what could be, needed for the future as well.
Thanks, Maureen. I did also want to mention, and I did such a cursory tour, that in addition to sort of the practical side of adoption, we spent a lot of time in the e-resource on health systems issues. So it's not purely up from a practice perspective, it's also from a sort of social and administrative division.
Next question, is there any potential to add modules on jurisdiction-specific health information technology that can support pharmacy practice? Many frontline pharmacists are unaware of the technologies available or emerging to support patient care.
Absolutely. So the approach in the design, and again, it sort of speaks to the matrix, was we did what we call an epitome model, meaning that we touched everything at least once with the potential for expanding. So I would like to see other versions be sort of more comprehensive, more exhaustive, more, I will say, deeper. So as we have a very brief section on sort of standardized vocabularies, for example. So that in and of itself could be a whole course. So yes, it has the ability to expand and actually to contract, which is sort of what Maureen talked about. We're looking at making a kind of a universal type course and stripping away, for lack of a better word, the pharmacy content and make it a bit more universal, which was a challenge when we were writing, but we had to speak to our audience.
Another question, it looks like pharmacy students will be increasingly prepared to function in an electronic world with this e-resource and expect the ability to do so as they engage in their practicums and upon graduation. What impact do you think this may have on the priority that provinces and territories are putting on advancing electronic medication, reconciliation, electronic prescribing, and consumer health solutions, such as allowing the public to electronically request prescription renewals?
Yes. So back to sort of the inception idea, my hope is that the e-resource would, I guess, do a bit of consciousness raising and have them be very mindful of all the complexities of it. I can tell you that the students who have been involved, whether they were in the development, et cetera, tend to think that they are quite conversant with the technologies and certainly have no difficulty utilizing them, but we would like to be sure that they're using them mindfully. So that's another idea we'd like to supplant, I suppose, in their consciousness. But I think that, the e-prescribing, the med-rec, et cetera, is all sort of coupled with accuracy and record keeping and documentation. So I think it's a natural fit, and I think it's one that they're really excited about.
And I'll just add, with the increased access to it by other clinicians and educators outside of, let's say, the classroom setting, that, it brings it really to the organizational level. And with that as well, it will certainly help to influence practice change. And that ties in nicely with the whole notion of our change management framework and the need for really solid, support for advanced training and education, and ensuring that our clinicians have the time to do that, in addition to providing patient care. So not always an easy task to achieve both, but certainly that's an opportunity for broader spread, and that's exactly what we want to happen, and that's our whole role of knowledge exchange and translation across Canada and internationally as well.
Actually, in listening to Maureen, it just struck me that it might be nice to have a learning site with preceptors and students acting as guides for one another. That would be an interesting learning space.
Yeah, perfect.
This is a comment on not that past question, but the one before it, and it's asking, can we send the content on standardized terminology to vendors too, with a little wink at the end?
Yeah, that's the elusive one, isn't it?
One more question, a bit related to a previous one, but is there any thought to offer this type of resource to those already practicing?
Absolutely. I think that this is a market that we need to kind of look at very carefully. When I was thinking about the badges and the certificates, I see this as a type of workplace training. So Maureen's already spoken about organizations. Maybe this is something we need to be looking at, you know, from a hospital and community pharmacy chain perspective. And I think that Harold Lopatka has that in view. I know we've had conversations about it.
Thank you. I don't see any further questions coming in, so we'll maybe just pop to the next slide there, Marie, to just let you know that we provided some additional Infoway resources as a reference for you. And now just next slide will wrap up. And I'd like to provide a special thanks to Marie Charlebois and Maureen Charlebois and Marie Rocchi. I knew I was going to do it. and I'm really hoping that all of you who've attended today have really enjoyed this session. Wanted to let everyone know that there will be an evaluation that will follow within a week, and that will include links to the PDF presentation and the recorded video. And I'd like to actually take a moment to offer a special thanks to Caitlin Burgess from Infoway Communications team, who's provided support throughout this. So I'll turn this back now to Monique.
And thank you again for joining us today. This concludes today's web conference, and you may now disconnect. Have a wonderful day.